Hello, Hello, everybody. This is Gary. Today is Saturday, March 25th, 2023. It is 3 p.m. Eastern Standard Time in the United States and Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm not doing so bad. I went out for my physical therapy and walking exercises. I went to the pharmacy to pick up my prescriptions. Um, I did some work on my computer. I do consumer surveys for extra money. It helps keep me busy during the day, which helps with my schizophrenia. My paranoia and delusions are not that bad. My auditory hallucinations are at a bare minimum. My depression is not that severe. Anxiety is a little elevated, but not too bad. Um, I will be seeing my therapist this upcoming week. I decided to stop seeing my peer support specialist. She doesn't have the same goals for me that I have for myself in the treatment of my schizoaffective disorder. I still have a psychotherapist, a psychiatrist, and of course a primary care provider and any medical specialist that I use. Um, I have an appointment, I believe, on Tuesday with the pulmonologist, the pulmonary specialist, because I have pulmonary fibrosis in my lungs, which means there's scar tissue forming in the air sacs of my lungs that makes it more difficult for me to breathe, especially if I exert myself by walking, climbing stairs, carrying something heavy from the store. Um, I tend to get very out of breath very, very quickly. Sometimes I even get nauseated. So I will be seeing the pulmonary specialist to test the strength of my lungs and see if we can determine what's causing the scarring in my lungs. It may be a chemical irritant like Clorox or chlorine. It might have been the fact that I used to smoke cigarettes for over 30 years and I quit smoking 15 months ago. Um, the scar tissue isn't cancer and it's not emphysema. It's more like just scar tissue forming in the air sacs, making it more difficult for the lungs to exchange carbon dioxide and oxygen. And it is not directly related in any way to any of the medications I'm taking or my schizophrenia. Um, but it does put extra stress on me because I'm worried about how long do I have to live. If it's severe, it's a 3 to 6 year lifespan after diagnosis of pulmonary fibrosis. If it doesn't advance, I could live a lot longer. I just don't know at this point. But it is causing me a great deal of anxiety and stress about not knowing what's going on with my pulmonary fibrosis. One of the biggest fears and anxieties I've always had was having a lung disease that would slowly rob me of my ability to breathe over time and make me dependent on oxygen, which I'm not on right now. I'm not on supplementary oxygen. Um, because I only get out of breath if I exert myself. Um, Not if I'm going around pretty much daily normal activities. I live in a very large apartment building, so I usually don't have to take the stairs. I usually just take the elevator. Um, but I'm seeing the pulmonary specialist on the 28th. Um, and that's all the report for now. There's not much else going on. I haven't been doing videos every single day. I've been distracted by other things. But today's been a good day. Can't report about anything bad happening. Um, but that's all for now. Like, comment, share, subscribe.